Hi, I'm Dr. Stitzel. The concept of using clinical testing and nutrient therapies for the treatment of adolescent idiopathic scoliosis is new to most parents, patients, and even some doctors. It's part of our ongoing effort to treat the whole scoliosis condition, not just the curve. On this page, you're going to find information about genetic variant, neurotransmitter, hormone, and bone health testing for patients with scoliosis. All the test kits are home collected, either urine or saliva samples, that are mailed into the lab. After the lab receives those results, it's then passed on to our technicians who will put it through our scoliosis-specific software and generate a report for you. This process takes about 4 to 6 weeks. Once you receive a report, it will outline what abnormalities or genetic variants were found, what and how they affect scoliosis, what nutrient therapies and lifestyle modifications are recommended to mitigate and reduce the effects this is having on the patient, and the costs of those interventions. For the patients who live outside the United States, we have a new product called the ScoliPacks for kids. This is going to cover most of the general universal nutrition that we have found is necessary for most patients with scoliosis. We estimate this will cover about 75 to 80% of their overall needs in the situation where they cannot undergo testing. It's very important to also recognize that the testing can be used completely independently from the Scoliosis Bootcamp programs, making them available to any patient anywhere within the United States for testing sample submission, and the ScoliPacks for kids is available worldwide.